keeping an eye on imaging. Discussion and commentary based on articles from JACC, Cardiovascular Imaging.
Hello, my name is Mort Kern. I'm the Associate Editor for JACC Imaging, here to interview Dr. Gary Tierney on his paper called Three-Dimensional Coronary Artery Microscopy by Intracoronary Optical Frequency Domain Imaging, a first-in-man experience. And Dr. Tierney, I just wanted to read the names of the co-authors so you can appreciate all the work that's gone into this. Dr. Tierney, Dr. Sergio Waxman, Dr. Milan Shaskovov, Vakovic, Sutter, Friedlich, Desjardins, O, Bartlett, Rosenberg, and Buma, an international contingent. And Dr. Tierney, welcome. And I wondered if you could tell our audience what is optical frequency domain imaging and how does it differ from our classic understanding of optical coherence tomography?
Okay, optical frequency domain imaging is a second generation form of OCT. It's sort of the evolution of the technology. And its main difference from a clinical standpoint is that it's capable of obtaining the same quality images but at a rate that's 50 to 100 or even greater than 100 times faster.
This is a fantastic advance in the field of imaging inside the coronary arteries. And can you briefly tell us how you acquire these images?
Right. So the reason why the speed is so important is because previously with OCT you had to occlude the artery in order to grab a long arterial segment of the high-resolution imaging with OCT. But now with optical frequency domain imaging, because you image faster, you can use a non-occlusive saline flush or purge and grab an entire artery length in a few seconds. And this really changes the clinical usability of intracoronary OCT.
Right. Can you tell us what we learned from your paper on these three patients?
So with our paper, it was a first-in-human experience, and we showed that in the three cases of the paper that we were successfully able to get high-resolution, three-dimensional imaging of coronary artery microstructure using this non-occlusive saline purge for a few seconds. Mm-hmm. And really, we showed that the technique is feasible, and it's quite a bit more convenient and probably safer than the proximal balloon occlusion technique.
It's a fantastic imaging paper. We've seen some beautiful images inside this, and I understand we're going to be able to see some moving pictures. Maybe you could describe to us what we might see when we look on the video clip that's attached.
The video clip shows a three-dimensional fly-through view of the coronary artery, sort of as if you're walking inside the coronary artery. If you'll notice, it's color-coded into different colors. The red corresponds to the artery wall. The white corresponds to calcium, yellow lipid, green macrophages, and blue is the stent itself. As you go from the beginning of the movie, which is the proximal aspect of the artery, to distal aspect, you can notice how the stent distorts the struts. You can see different calcium nodules as you fly through the artery. And then at the end of the artery, you see a large lipid-rich plaque that's protruding into the lumen.
That's fantastic, and I know the viewers are going to enjoy seeing those images. Now, can you tell us about some of the ongoing studies that you have planned for this novel technique?
Well, right now, our system is in the middle of a multi-center clinical trial to study the natural history of vulnerable plaque on a microscopic level. We have systems at the Leahy Clinic, Columbia Medical Center, and Erasmus Medical Center, and all participating in this and other studies from our group.
And tell me, what do you think will be the major findings from such studies? What are we going to learn from this?
Well, because the technology is capable of identifying many of the features thought to be associated with plaque rupture and AMI, we think we'll be able to look at plaques ahead of time and determine the clinical significance of actually having a plaque with a certain type of microstructure. And then hopefully we'll be able to also look back retrospectively after the second imaging point, and for plaques that do have a thrombus or have caused an event, we'll be able to go back in time and look at what they looked like 12 or 18 months earlier.
Right. This could really set the stage for understanding artery disease in a way we've never seen before.
Absolutely.
Right. Can you tell us what you have planned for the future with regard to this technology?
Well, the technology is ever improving. We're increasing the speed so we can get even higher resolution imaging. We also have an add-on to the technology called polarization-sensitive optical frequency domain imaging, which provides information about the collagen content of the plaques, as well as the content of smooth muscle cells in the plaques. But in addition, now I think that this technology is really getting a lot of visibility in the cardiology community, and one of our main tasks is to standardize the technology so that it can be used by more people and to validate those standards.
Well, that's fantastic. I want to thank you for this wonderful discussion. Your images are absolutely magnificent, and I want to thank the audience for tuning in and listening to us talk about optical coherence tomography and optical frequency domain imaging. Thank you, Gary.
Thank you.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.